My name's Caleb, and I'm from the state of Georgia in the U.S., and I did my undergraduate studies in biology and psychology. I also have work-related experience in pharmacy, hospital, and research lab settings.
My name's Jaime, and I was a medical student at the Hull York Medical School before I decided to come to the Department of Health Sciences at York and study for a Masters in Public Health. So what I'm doing at the moment is I'm intercalating, and that's something that quite a lot of medical students do, where they take a gap from their studies and take a year out to do maybe a BSc or a master's degree in another subject, and I chose to do a Masters in Public Health.
I decided to do the Master of Public Health after I went to Haiti a few years ago, and I was exposed to different issues that were impacting the health of the local population. So is this wanting to improve upon my knowledge of health outside of solely clinical practice?
I'd had lots of very interesting teaching on public health in my undergraduate medical degree, and I was finding it much more interesting than really anything else I was learning. So it seemed like quite an obvious choice when I thought about what I might like to study more specifically for a year out.
I chose the Department of Health Sciences at the University of York because I like the diverse and global perspectives that are offered in the MPH course. It's also very close to the city of York, which is a beautiful city in Britain and has a rich culture and history as well.
I'd been a student in York for the past 3 years, and I knew how much I loved the city and the surroundings and the campus itself. And because quite a lot of the staff who teach on the Masters of Public Health also teach on the Hull York Medical School curriculum, I knew how friendly and approachable and how enthused about their research they were.
What I like about studying in the department is the amount of resources available. So that could be from the staff in the Health Sciences department to library staff. And the lectures that we have to come and teach us throughout the course are usually specialists in their field. In particular, those from Global Public Health, we had instructors from different parts of sub-Saharan Africa come and really discuss the issues that were going on there.
I really enjoy the way that there are lots of different people from different backgrounds here, so both in terms of where they've come from in the world and in terms of what they've done previously, whether they've been a student or worked in public health or in a related discipline or in a completely unrelated discipline.
As a US student, it's been particularly great to be able to talk with those that have experience in the National Health Service, because it's quite different than what we have in America, and it's really shaped my perspective on different problems. But throughout the course, there's key points where group work is compulsory to solve health-related problems. And I think this really helps to develop key skills that you're going to need as you move from being a student into full-time work in public health.
Once I've finished my Masters and then gone back to medical school and finished medical school, I'm hoping to train as a registrar doctor in public health and then eventually become a public health consultant, and that's really, really exciting.
I would say if you're considering doing the Masters of Public Health, then you should definitely do it. You'll have the flexibility to choose modules that tailor to your specific interests or field of research.
The teaching is top-notch, and there's lots of really interesting things going on all the time. The campus itself in York is beautiful, and having the city nearby is great, and I've just really enjoyed my time being a student here.
In addition, you'll be surrounded by a range of backgrounds from both your peers and instructors. This will in turn challenge your way of thinking and completely redefine your perspective in the best way possible for a career in public health.